Oh, right, the comments about the Rachel Tussey story, the very sad story of
Yes.
the TikToker who passed away after plastic surgery. And so I didn't mention this when we did that segment, but there were people in there saying, why did she have this done at a surgery center? That's so crazy.
Oh, yeah.
And they're always done in surgery centers, not to spoil my whole segment, which I'm about to do. But given the sad story of Rachel Tussey, the TikToker who died from plastic surgery, I wanted to do a segment on the safest place to actually have your plastic surgery. And I'm going to go over what all the options are, like where can you have plastic surgery, and what are the pros and cons of each. Because I think it's important, and this is something I talk about, not directly in its own segment, but I'm always kind of talking about it when things go badly, and I say, oh, by the way, this happened here, and I don't like that. So what are your options for the location that you have plastic surgery? Do you know, Brenna, I'm going to ask you this question, I'm not expecting you to know it, but like, what do you think? Like, say, like literally, what are the physical places you could have? And I'm asking this not because I expect you to know it, but I'm asking as somebody who's not in the biz.
Yeah.
Like, do you know where these things are even done?
I don't know if I have the right terms
It's
for
okay.
like surgery
You don't have to have the right
center.
term. Okay, surgery center.
Yeah,
That's great.
I would think
That's
that.
perfect.
That's like my first
Okay, that's very, very good.
guess.
Yeah. Okay, so and I'm not asking this to put you on the spot. It's not
No,
like
yeah.
that. I'm curious what the average person who's
Yeah,
not
no, totally.
medical, thinks about it. Okay.
Yeah, I haven't really thought about it. So
Okay,
it's,
all right, well, good. Then maybe this segment will be good for
yeah,
you.
but like if it was like someone's house, like I don't know if I would trust. I would
right.
not.
I
yeah.
didn't even include that one, but you are right. It could be something totally non-legit. I'm gonna add that one in the end because you mentioned it. Okay, all right. So let's start at the top. Let's start at the most highest level of care, which would be the hospital.
Yeah.
Right, a full-on hospital.
That was like my second guess.
So, in a full-on hospital, most people would think, oh, that's the best. But there are some really, really great benefits to having surgery in the hospital, and there's also some big downsides. And so what are the big benefits? Well, a hospital has a full ICU or intensive care unit. It has the ability
If something goes wrong.
Yeah, it has the ability to take care of the absolute sickest patients and have it done immediately. Unlike the sad case of Rachel, the TikToker, like when she had a problem, they had to transfer her from that facility to the hospital, right? And there's a lot of time. You have to call 911.
Like the 6 minutes of no oxygen. That was probably during that transition.
And that happened even before they even called 911.
Oh my gosh.
I think, right? And
yeah.
so, the time from, okay, there's a problem, call 911, ambulance arrives, ambulance assesses, ambulance, maybe puts a breathing tube in the patient, loads him in the ambulance, takes him to the hospital, brings them into the ER. I mean, easily an hour can pass.
Yeah.
Easily, right? And so if you're having surgery in the hospital, that, transition time doesn't exist. So that is a benefit. You also have an immediate access to specialists, right? All of the doctors are going to be in the hospital for the most part. I mean, if it's the middle of the night, perhaps not every doctor is there, but you do have doctors in the hospital 24/7. So hospitals are great for high-risk patients or high complexity cases where there's a significant risk of complication because of all those safeguards. However, if you're talking specifically about elective surgery, and even more specifically elective surgery that's out of pocket like aesthetic plastic surgery is, there are some downsides. First off, it is cost prohibitive. I've had patients before that came in for a consult for a cosmetic surgery, and for whatever reason, they had some medical issue that basically negated them from having surgery at a surgery center. And they would ask, well, what would it cost to do it at the hospital? And I've had 0 patients in 16 years who took me up on that, because when you get a quote from the hospital, it is astronomical.
Yeah, it skyrockets for sure.
Yeah. So like, for example, like to have like a tummy tuck and maybe your breasts done in a hospital, I mean, I didn't actually price it, but I would guess that the hospital fee for out of pocket would probably be minimum of $30,000.
Oh my gosh.
Like just the fee for the OR would be 3 times as much as the surgery would be if you had it at a surgery center. And that's like a low estimate. It could be 50 or 60,000.
Oh my gosh.
So that becomes cost prohibitive. So realistically, and I've been doing plastic surgery now, private practice, 16 years, which is a fair amount.
And you haven't done it at a hospital? Or have you?
Not anything cosmetic.
Okay.
No, I don't even think I've done any surgery out of pocket, which means it wasn't done through insurance in the hospital.
Okay.
I know we've asked a few times to get prices, and it always just ends there because the price is so high. I may have done one really short case in a hospital at one point. If I did, I don't remember it. But the cost prohibitive part is huge. Also, it's slower in a hospital. The turnover times are slower, which can drag out the day, which can potentially add some risk if there's not as many people around.
Is that because of like priority or in the hospital?
I wish I could tell you. It just things run slower in the hospital.
Yeah, it makes sense from like
turnover time, like in a surgery center, is very rapid. Like they just have people that are there to make sure cases go smoothly. In the hospital, it's almost if it's not a priority.
Yeah, that's exactly what I was.
It's very routine to finish a case in a hospital and not start your next case for a minimum of an hour or longer. And that's just the way it is. And so that does potentially set up some issues where, maybe your case doesn't get to go because it took too much time and they don't have anybody left to work. And it's not necessarily safer for low-risk cases because one thing about the hospital that people don't think about is there are a lot of very, very bad bacteria in hospitals.
Yeah, you're exposed to a lot.
You're exposed to a lot of different bacteria that don't exist in a surgery center.
That's
There's
so
a lot
true.
of multi-drug resistant.
Cross-contamination.
Yep, cross-contamination of multi-drug resistant bacteria, which are much more likely to be in a hospital than they are in a surgery center.
Yeah.
So, so to summarize, should you have your elective plastic surgery in a hospital, and by elective I mean cash for service, so like a tummy tuck, breast aug, this and that, the other. I mean, absolutely not. Not to mention something I didn't even talk about was in my surgery center, I'm set up to do these surgeries. I have the equipment I need. I have things like, implant sizers. I have all the tools that are specific to these procedures, and they don't necessarily have those in a hospital setting. And so if you're trying to do these in a hospital setting, you may be trying to do it without the equipment that you're used to. So hospital is not a good choice. Now, next you have the ambulatory surgery center, however you want to call it, where the absolute majority of aesthetic surgery is done. And I personally think that these are the best. I think if I lay out the pros and cons, I think most people would agree with me. Why do I think they're safe? Well, a very, very high number of these surgery centers are accredited. And most good surgeons will not work at a surgery center that's not accredited. So what does accreditation mean? Well, it means that these different governing boards have basically told the surgery center what's required for them to get accreditation. They've done it, and then they've had site surveys to make sure that they're following through. And that could be like CMS, Joint Commission, the Quad ASF, and the AAAHC, which are these different governing boards which regulate what needs to be done to make sure this place is safe. What are the protocols? What are the emergency equipment, the emergency protocols? And it's actually really involved. And anytime a surgery center is about to have a site survey, they're like on high alert because there's a lot of stuff they need to make sure is done properly or they could lose their accreditation. And they also have credentialing and privileging of surgeons. Now, hospitals have that too, but the next one I'm going to mention does not. You cannot go as a internal medicine doctor or a general surgeon or OBGYN and get credentialed to do plastic surgery. They're not going to give it to you. You don't have the proper training. You don't have the proper board certification. So there is that layer of protection that at least if you're in a surgery center, you know that your surgeon has at least been trained and certified to do what they're going to do. They do have a lot of emergency equipment in a surgery center. Probably not as much as the hospital, but they have a very good amount. And they have protocols for what to do if something goes wrong. So, in my opinion, ambulatory surgery centers are extremely safe. No, they don't have ICUs, they don't have doctors in there 24/7, but for elective surgeries that are not considered high risk, you don't really need that. Now, the last one, not really the last one because I'm going to add what you said, but the third one is office-based operating room. So that means that I open up an OR in my medical office, and that's where I do my surgery. And I'm not a huge fan of these. I've actually, both of the training programs that I was at had those. They had office ORs. And I do think that the guys that I trained with, because they were very legit and even in some cases famous surgeons, had really nice ORs that I think were on par with a surgery center. However, they're definitely not all like that, because the regulation of office ORs is across the board. You'll get some that are really, really good and some that are just skating right above the law for what's required, and they don't have near the amount of equipment or protocols that a surgery center would have. So although I think an office OR could be very close to the safety of a surgery center, you as a consumer have no idea whatsoever if it actually is. Even I would have to dig a lot to find out if somebody's office OR was truly safe.
That's true.
What certifications does it have?
Yeah.
When was the last time they were certified? What emergency, protocols do they have? What emergency equipment did they have? Because the laws do not necessarily protect patients. You can run a super shoddy OR in a lot of states, Texas and Florida included, that technically you can do surgery in them, but they are a far cry from the safety of a surgery center.
I was going to ask, is that what, I guess out of the country usually is OR?
Who knows?
Or Miami?
Yeah, who knows? I mean, if it's one of those things where I can't tell if it's safe, how is a patient going to know? How are they going to know? You can't tell by looking at a website.
So scary.
Yeah, it's
very
like those
sketchy. Horror movies. I'm watching, this is kind of off topic, but I'm watching The Hunting Party on...
I haven't seen it.
It's a show on Netflix. It's new. But basically, every episode is they're trying to catch, I forget what they're... Like a killer? A serial killer. Okay. Yeah, I was
is it a reality show or is it fiction?
No, it's definitely fiction, but... Okay. Yeah, but the last episode I just watched, he was a surgeon. So basically he was killed and brought back to life. So now he does that to his patients to try to see what they saw whenever they died.
It's like that. Have you ever seen the movie Flatliners?
I think so. Is it old or is it a newer one?
So there was the original, which was in the 80s or 90s.
I think my dad made me watch that one.
Yeah, basically it was medical students that were basically putting themselves into cardiac arrest to see what death was like. And and they were having these weird kind of visions and stuff. I think they made a remake too, actually. But yes.
Anyways, don't know why I brought that up, but it's scary. You can't. Who's reliable?
You could not do what that guy was doing in a surgery center or a hospital, but you could do that in your own OR. Do something really weird like that. Now, eventually, you would get caught, but. If you try to do something like that,
it can do enough damage.
Yeah, in a surgery center, they're not going to let you do something that's off the rails. It's like those cases that we talked about where the patient went into cardiac arrest and the surgeon wouldn't call 911 for hours.
Yeah.
That stuff can't happen in a surgery center. Also, there is no credentialing. And that's where these non-plastic surgeons, these fake plastic surgeons, cosmetic surgeons, do all their work. They don't do them in surgery centers. Why? Because they can't get credentialed. But can they credential themselves in their own OR?
Yeah.
Yes, they can. And no one's asking them, when their OR gets whatever, piece of paper it needs, what's your credentialing like? So I'm not a big fan of office ORs. There are some out there that are extremely safe, and I'm not saying that everyone is bad, but it's just that unpredictability of, is this one safe?
Right.
I don't know.
How reliable?
I don't know. I don't know if I could tell. I would have to dig into it, and it's I'm not going to deal with that. That's one of the reasons I haven't done my own OR. Plus, it's just kind of a hassle, to be honest. So, and then, like you said, okay, what about having plastic surgery in a back alley? Okay, obviously bad, right? I mean, I don't think anyone's going to...
a McDonald's address.
I mean,
where am I?
We talk about it all the time. People have plastic surgery in someone's apartment or a hotel room.
Yeah.
Obviously, don't do that. That's very, very bad. But yeah, and going back to that Rachel Tussey case, I mean, we don't know all the details, but it sounds like it may have been a medication issue, which that literally could happen anywhere. That could happen in a hospital, that could happen in a surgery center, that could happen in someone's office OR. The one thing I will say is if it happens in a hospital, at least you don't have that delay to get to the hospital. But again, there's downsides to doing these type of surgeries in a hospital. One, you can't afford it. It's unaffordable. And two, there's always that risk of catching like some, super
Yeah, I didn't even
resistant
think
bacteria.
about that. I would
Yeah.
have thought like hospital would be like right up there, but
It is and
Yeah.
it's not. It's like there's
It's-
pros and there's cons.
it's such-
I personally would not want to have elective surgery in a hospital.
Yeah.
Personally, I would much rather go to a surgery center knowing what I know.
Mm-hmm.
Now, if I'm having something really crazy like open heart surgery, well, yeah, I want to have that like in a full-on hospital.
Mm-hmm.
But like if I was having my gallbladder out or I don't know something like that,
Yeah.
surgery center all the way. So, but yeah, that kind of rounds it out. Like to me, surgery center is the best. I mean, I guess office OR has to be second because hospital is just not realistic unless money is no object, which it's always an object.
right.
So, realistic plastic surgery happens most commonly surgery centers. Office ORs are a thing, but you just got to be careful, and it can be very difficult to know what's what. So.
Totally.